Okay.
Hey everyone, thank you all for coming to class tonight. My name is Chad Rowell. I'm paramedic with Clarendon County EMS. Today we're going to be discussing adult innovation. We're going to discuss the 12 proper steps to achieve correct oral tracheal intubation. In your career of being a paramedic, you'll have a call where seconds matter in life or death. A lot of times you're going to have an airway issue, and if you can correct that problem rapidly, you'll have a successful outcome of your patient. Innovation is a key that every paramedic has to have to become a paramedic. A little bit about myself. I've been with EMS, or been in EMS for 13 years, a paramedic for the last 4 of those years, and assistant supervisor for 1 of those years. I attended a difficult airway class last year, and I'll be able to bring some of those skills I learned in that class to this class. In the next few minutes, I'm going to cover preparing your equipment, the 12 steps of proper intubation, and confirming correct tube placement when you're done with your intubation. So let's begin with preparing your equipment. First of all, you're going to decide if you want to use a Miller blade or McIntosh blade for your intubation. Which tonight I'll be using the Miller blade. You've got to make sure you have your proper PPE, which is going to be gloves and at least eyewear. Going to get your stylet, get your select the correct size ET tube. Go ahead and place your stylet in it and attach your syringe to your ET tube. Go ahead and pump up your cuff, make sure you have no leaks and everything is working there. Now go ahead and open up your CO2 detector and place it out by your side. And also you want to have suction readily available in case there's some secretions in the airway that you need to suction out. I've attached my Miller blade. You want to check your light, make sure your light's tight and bright. Then we're going to move into actual intubation. First of all, you want to prepare your patient by pre-oxygenating them. You'll have your partner in the truck with you. They'll be applying the mask and pre-oxygenating your patient for you while you prepare all your equipment. Next, you want to get at the head. You want to open the airway up and look, make sure there's no secretions or anything. If there is any secretions, take your rigid stop or rigid suction out any secretions you may have. Then you want to move into your intubation. You want to come in on the left side of the head, identify your landmarks, find your trachea, and then place your ET tube in your trachea. You know, position it approximately ½ inch to 1 inch past the vocal cords. You're going to remove your stylet. You're going to inflate your bulb. Apply your EasyCap CO2 detector. And you want to ventilate your patient. On your CO2 detector, you want to go for gold. If it's purple, you have incorrect tube placement. Also, you want to confirm placement by auscultation. First, you want to listen over the epigastrium, make sure you don't hear any gurgling on inspiration. Then you want to listen over apex, apex, base, base. Make sure you have adequate lung sounds. And now that we've confirmed the tube placement, we want to come in, we want to secure our tube. Once you have the tube secured, you'll continue to ventilate throughout your transport to the hospital. You can also use sterile suction if they have any, when you listen to lung sounds, if there was any gurgling or any kind of unusual noises, you can do some deep sterile suction. You'll continue to ventilate your patient on to the hospital. So at the conclusion, there are 3 key steps in successful intubation: preparation, intubation, and confirmation. Hopefully following these steps, you'll continue to have accurate intubations throughout your career in EMS. As I stated in the introduction, we will encounter a time when intubation will be crucial in the outcome of your patient, and hopefully this will help you have a successful outcome. Thank you. Did you zoom back out?